Good evening, everybody. Today, I would thought that we will talk about wisdom tooth. As you all know, that a wisdom tooth is the last tooth to erupt in our oral cavity or into our mouth. So, wisdom tooth are called as wisdom tooth because they erupt into your mouth when you achieve wisdom. That is almost from the age of 17 years to 25 years of age. So in that period of time, from 17 to 25 years of age, these last teeth erupt. So the full complement of teeth, as we say, is 32. Now we have got 28 teeth which everyone gets erupted, but then the 4 teeth, the last 4 wisdom teeth, erupt at that particular age. Now when the wisdom tooth erupts, it causes a lot of clinical features. There are a lot of problems what patient faces. As you are seeing, the patient can have a simple pain into the jaw, which could be a simple pain into the jaw in the last area of your lower jaw or an upper jaw. That pain could be involving into your jaw. It could radiate towards your head. You may have a headache. You may sometimes have a swelling into a localized area. Your lower jaw may have a swelling. The pain can radiate to your head. You may have headache. You may have earache. You may have, and when the wisdom tooth is trying to erupt, it is always not necessary that wisdom tooth can erupt totally into the mouth. So when it is trying to erupt in that particular age, it will show all these features when there is no sufficient room for the tooth to erupt into your mouth. So all these clinical features will only happen when the tooth is trying to erupt and it is not getting a space for it to erupt, or it is getting infected or affected when there is a problem in the eruption. Now, these are the 4 different types of eruption difficulties what patient can have. Now, normally what happens is when the tooth is trying to erupt and the tooth is not getting the place to erupt, the tooth is stuck inside your jaw, which is called as impacted. So, this condition is called as the third molar impaction. Impaction means the tooth is between your bone and your second molar, which is called as your second molar. Now what happens is this wisdom tooth, when trying to get erupted, gets impacted into the bone. As you can see in the picture, it can get impacted horizontally, or it can get impacted at an angle. It is trying to erupt and trying to hit the adjacent tooth, or it is vertically impacted, or it is in the soft tissue. That means the tooth is erupted but covered with the gums. So any of the 4 things can happen when the tooth is trying to erupt and then it is getting stuck because there is no sufficient place. And that area where it is getting stuck is your bone, on which there is a gum which is covering, because of which you are getting lot of pain and lot of swelling, infection, bad breath, and all the features which I mentioned before are because the tooth gets impacted. Now in this condition you can see that it is not only the lower molar which is always getting into trouble, it is also sometimes the upper molar also. So this wisdom teeth issues or this pain is mostly in the lower area, but also mind you, most of the people will get their upper molars erupted, but sometimes even the upper third molars, the upper wisdom teeth, are also getting impacted, as you can see in the picture. Even that causes similar type of pain radiating to your ear, getting earache, headache and everything. So you have to understand that these wisdom teeth are most of the common teeth which are showing a lot of issues. Now this is also a condition where the wisdom tooth is erupted, as you can see in the picture, but then you can see that there is a gum. You can see this arrow which is showing the gum which is covering. The tooth is erupted, but there is a gum which is covering the tooth. Now when the gum is covering the tooth, now what do we have to do? That because there is a gum, there is a lot of food getting stuck in between, and you can see a mild decay into the tooth. So we may have to take care that the tooth is erupted, tooth has got sufficient place in the mouth, but only thing is because of the gum which is covering, we may have to treat the gum itself. So that is also one of the conditions which may happen to few people. Now these are the most important thing, that if the tooth is getting impacted, what are the consequences of it being impacted? Now when the tooth is trying to erupt, as you can see in the picture, this tooth is causing the decay into your adjacent molar. It's a good tooth. It's a total, you can see the nerve, you can see the pulp. It is absolutely good tooth. But then because of this third molar, because of this tooth is hitting your adjacent tooth, and you can see the black color discoloration. It is causing the decay into your adjacent tooth. That means you are losing a good tooth because you are not getting this third molar evaluated, or you are waiting for the symptom to happen, and this is what is the consequence, that you will lose this tooth also. So both the teeth are at stake when we are ignoring the wisdom tooth pain. In some cases, the wisdom tooth, as you can see the arrow, is trying to push the adjacent teeth. Now what happens is when the wisdom teeth are trying to get erupted, they are not causing the decay, but they are trying to physically put the pressure on the adjacent teeth, and this is causing the consequence of getting the pressure on the remaining teeth, and sometimes in that age of growth of the teeth and the jaw, there is a cause of crowding also. All the teeth are getting pushed, you see a radiating pain, a vague gnashing pain into your jaw. Sometimes the wisdom tooth is not erupted totally, it's inside the bone, and this is something called as a cyst. There is a sac. Cyst means like a bag. It's a small sac which is there, which surrounds your tooth and gets filled with the liquid. Then it is called as a cyst. So there are chances that a wisdom tooth which is not pulled off can have or retain itself into the jaw, can form a cyst, or can push the adjacent teeth, or can cause the decay to the adjacent teeth, making sure that the adjacent teeth is almost loose, mobile, decayed, causing a lot of pain to you. The most common consequence of wisdom tooth is also where the gum which is covering the wisdom tooth gets infected. This is called as pericoronitis. Pericoronitis is infection of the gum above the tooth. You can see the red inflamed gum. Now what happens is the wisdom tooth is partially erupting, you are ignoring it, there's a lot of food which is going and getting stuck into the teeth, and then the gums get swollen up. Then from the upper tooth you are biting. Then what happens is when the upper and the lower wisdom teeth are going to have occlusion, when they contact each other, the gum comes in between, which leads to the gum infection. Gums become swollen, you start getting bad breath, severe pain. The main consequence is because of all of these things, you start getting trismus. Trismus means restricted mouth opening. Your difficulty of opening the mouth becomes a problem. You get a severe pain, which may sometimes lead to fever, sometimes lead to even your lymph node, which is the adjacent, also little swollen up. Now, what happens is, as you can see in the picture, wisdom tooth infection. That means this is what I was telling you is a pericoronitis, where the gum over it is almost covered. And in this cases, what happens is we will try to check whether is removing the gum only will be sufficient for you to relieve from the problem, or it is also the tooth. So every case when there is pericoronitis, it is not necessary that only by removing the gum area it is enough. Sometimes we may have to also tell that the tooth is also infected and tooth is not going to erupt anyhow, so we have to pull off the tooth also along with the gum tissue also. So that is what is the treatment plan, what is decided, which is always at the discretion of the dentist or an oral surgeon, whether we can do surgery where we remove the gum tissue, which can be done with blade and laser and other things, or else we may also have to remove your teeth. Now these are your x-ray, these are your radiographs which are showing that these are your impacted positions of the tooth. The red one which I am indicating that the tooth can erupt in various directions, as I said, horizontal, vertical, and these issues will happen with this type of teeth. Now the most important thing is, what are the FAQs? So what are the most common FAQs which are most of the patients ask, or most of you all have? The first thing is why this tooth has to be removed. The most important thing is this tooth is a vestigial organ. It's like in our body we have some vestigial organs, like we have appendix. Appendix also causes pain. We remove it because it is not having any function. Wisdom tooth also has no much function into your mouth. It is not going to help you in chewing, it is not going to help you in mastication or anything, neither for your cosmetic. So wisdom teeth have got no much importance or function into the mouth. So removing a wisdom tooth, don't give a second thought when it starts giving you symptoms, and don't wait for the symptoms. Second most common question is, do we have to wait for the symptom to get it removed? No. See, that is why we always make it very clear, and we always reinforce on one aspect that 6 monthly dental checkups are necessary, because the dentist can tell you whether your tooth is in what position, whether you have a wisdom tooth also or no. So there are also cases where there is no presence of wisdom tooth into your jaw. You already have 28 teeth. There are no other tooth germ into your mouth. So whether you have wisdom tooth, whether there are chances of it getting erupted, or maybe there's a cyst formation inside. So regular dental checkups, regular evaluation, regular radiographs to be taken by the dentist, and we look into it and we let you know what exactly can happen. So checkups are important, and don't wait for the symptoms. If you have a wisdom tooth which is trying to come or affect the adjacent teeth, get the removal done, because once symptom starts, it becomes very difficult, because you have to take a long course of antibiotic, then you have to bear the the morbidity, the agony of the pain which is there before the extraction, then followed by extraction also. So that will be always there, and once the tooth is removed, you can go ahead with your lifestyle. It's not going to have any effect. So all the myths of getting it extracted having any side effects on your eye, getting the side effects on losing a tooth, and getting it replacement done, because this is also one of the very important FAQ which people ask, that do I have to replace this tooth after the extraction? No, because as I said, this is the last molar of your mouth and we don't need to replace it because it has no one function. Fine. So this is all, I hope, solves all your queries with wisdom tooth and its removal. Thank you very much.